Just a welcome again to everyone. I think we could go ahead and get started. My name is Lucinda Bryden. I'm Director of Alumni Relations at SUNY Delhi. And it's an honor to welcome you on behalf of the SUNY Delhi Alumni Association. It's my pleasure to introduce Dr. Susan Dean. Susan is the ultimate nurse educator. She's a professor and dean at Delhi School of Nursing. Susan earned her registered nursing degree from St. Francis Hospital School of Nursing, her bachelor's at St. Joseph's College, and she also holds a postmaster's certificate from Drexel University and a master's degree in nursing education from Hartford University. Most recently, Susan obtained a research and professional doctoral degree focusing on educational leadership from North Central University in San SUNY Delhi is truly fortunate to have Susan's dedicated service for more than a decade here at the college, and she served in various positions, including as interim provost. We have an equally impressive panel of alumni nursing educators here today to join Susan, and I'll turn things over to you now, Susan, to introduce them. Thank you very much and enjoy, everyone.
Thank you, Lucinda. Thank you for that very nice introduction and welcome. Thank you, everybody. As Lucinda said, I am Dr. Susan Dean, the Dean of the School of Nursing, and it is with great pleasure that I moderate today's session. And so I'd like to begin by introducing our panelists, and I will start with Anthony Bryant. Anthony graduated from our MSN program in 2020. He has worked in various clinical settings throughout his career, including med-surg, antepartum, postpartum, rehab, home care, insurance, and education. He is a certified medical surgical registered nurse and currently a member of Sigma Theta Tau and was just named secretary of his organization's curriculum committee. He is a nursing faculty member at St. Joseph's College of Nursing in Syracuse, New York. He has spearheaded numerous technical innovations at the college, and it includes reconstruction of the college's video library, integration of the next generation NCLEX, and revamped of the current evaluation processes. In the fall, he will be conducting qualitative research with colleagues in the use of a clinical tool for enhanced clinical preparation. In addition, he will be coming on board as adjunct faculty for our online BSN program. The next panelist is Tammy Chandler. Tammy actually graduated both from Delhi with her BS and MSN. Tammy originally got her associate degree at SUNY Morrisville, and she is also a certified medical surgical nurse and has clinical work experience in medical surgical, neurosurgical ICU, and medical surgical float pool. Her experience as a nurse educator is varied. She was a clinical instructor at Pomeroy School of Nursing at Cross Hospital, a clinical instructor for our associate degree program at SUNY Delhi, and a lab instructor at SUNY Morrisville. And currently she is a full-time faculty here at SUNY Delhi in our online BSN program. She has a pretty impressive volunteer experiences, including medical missions with Remote Area Medical, RAM, in both Fort Myers and Fort Lauderdale, medical mission to Bolivia with Samaritan's Purse, medical mission to Belize with International Servants, and she is a faith community leader with the Alzheimer's Association. Thank you, Tammy, for being here today. Next is Rebecca Sullivan. Rebecca Sullivan completed her Delhi MS program in May of 2020, where she was inducted into Delhi's chapter of Sigma Theta Tau. She currently works with students in the Clinical Skills Lab and teaches maternal child nursing at SUNY Morrisville. She is a BSN graduate of University of Pennsylvania, where she was an undergraduate research assistant for the Children's Hospital of Philadelphia, known as CHOP. And upon graduation, she worked in the neonatal ICU at CHOP and continued to be a NICU nurse here in New York. She is a Board of Education member at her local school district and a member of the Health and Safety Committee. She also took part in RAM as a MSN student at Delhi, and she continues to be inspired by public health outreach. And she's a volunteer for Chenango County COVID-19 vaccination clinics. Thank you, Rebecca, for being here today. And last but not least is our Karen Driscoll. Karen has completed the Delhi MSN program in 2019. She's an adjunct instructor for us here at SUNY Delhi in our online programs, and since 2019 when she graduated. In addition to teaching, she spent over 20 years caring for adult oncology populations with a special interest in palliative care and end-of-life care. She is also passionate about rural health, health policy, community building, and advocacy work. She currently serves as the co-chair of the Nursing Advisory Board of the Cholangiocarcinoma Foundation in Harriman, Utah, and is a volunteer member of the Catskill Addiction Coalition Steering Committee based in Margaretville, New York. Welcome, Karen. So now with those prestigious introductions, I would like to start with some questions. And the first question, of course, comes to, why did you choose to become a nurse educator? And what would you find is the most rewarding aspect of this type of work? And let's start with Rebecca Sullivan.
Hi, good morning, good afternoon, actually. I'm very excited to be here. So why I chose to become a nurse educator. It actually was not something that I had ever thought that I wanted to do until I went into bedside nursing, and I found that I really enjoyed precepting, which for some nurses just is not their thing, but for me, I really enjoyed it. And I really enjoyed when we had the nursing students come in for their clinical or some sort of rotation. And so I found I just enjoyed engaging with them and teaching them and watching them, like as they discovered new things about themselves, about the unit, about nursing. And it just really kind of spurred in me something that I wanted to pursue further. So I did. So I enrolled in the program. I had been teaching before I enrolled at Delhi. I had been teaching for an LPN program. So sort of dipping my toe in the water just to see what it would be like to teach nurses. And I really enjoyed it. And so I just continued on so I could be teaching at a higher level. And I guess the most rewarding, and I'm sure everybody kind of feels the same way, but the most rewarding are those aha moments when you see it in their eyes, when you see it in their actions, that they get it, that it just all connects suddenly, and like the light bulbs, start to pop in their eyes and all around them. And so I think that's one of the most rewarding aspects. One of the aspects that I teach at Morrisville is simulation. So we do simulation. We start very early on, very simple, very low fidelity in that first semester, and then we progress, and they have 1 or 2 or 3 a semester until they graduate. And it's really neat to see and really rewarding to see those first sessions where they're so awkward and so nervous, and they can't even pronounce some of the words, and they bump into one another, and it's really it's almost painful sometimes to watch them. To go from that, and then you see them 3, 4 semesters later, and it almost brings tears to your eyes how confident they are, how they walk in there, how their clinical judgment is on par, and statistics and lab values and medical jargon is just rolling off their tongue, and they're there, they're ready to go. And just that progression and to be part of that journey is just amazing. There's a lot to be said for bedside nursing. That's amazing, but that's a different kind of satisfaction that I really, really, really enjoy. And I look forward to working with them someday, maybe in clinics or hospitals.
I think there's nothing rewarding or gratifying. I always put a smile on my face when you did see that light bulb go on. That aha moment was like, yes.
You get it.
Anthony, what about you? Why did you choose to become a nurse educator?
So I have to be honest, when years ago, I used to be like, there's absolutely no way I'd ever teach a student ever. Like, I don't have the patience, I don't have the time, like I could never do that. Until I started teaching them on the floors. And it's very weird. Like when I applied to nursing, I did it on a whim. Like it just felt the right thing to do. I never really had a rhyme or reason why I became a nurse. It just felt natural. And so I applied and I did, and it still felt natural. And pretty much the same thing happened with teaching. As soon as I was with the students on the floor, I enjoyed it even more than precepting nurses, because they were so excited about every little thing. Like you think emptying catheter would be something very minute, but they were just so incredibly excited. And I just love that passion for learning, and nursing students just really have that. So that was great. And a little along the lines of what Rebecca said, when I'm with the students um, and patients too, when they have a task that seems insurmountable and they're just like, there's no way I'm ever going to achieve this. I'm not going to be able to do this dressing change. It's too daunting. I'll never do it. And then you facilitate them getting there. And then when they actually achieve that goal, there's nothing that compares to that success. And it's a moment you share with them, which is something I never realized until I started teaching, about how big those moments are, and just how respectful they are that you directed them there. Um, and honestly, I think the most rewarding part of being a teacher is the humanistic value in it. Um, when you see an educator from the outside, you're just like, they teach them and that's it. And it's very like black and white until you become a teacher and you're like, oh my God, all those things I counsel my patients on, I do it with my students too. They bring all their lives, their experiences, their various skills, and they teach you every day just like you teach them. And it's just such a unique thing. And I just love that it's so adaptive and it's wonderfully challenging, and every day is truly new, and you have to be on your A game because you're balancing patients, students, faculty, everything. So it's extremely rewarding.
Thank you, Anthony. Tammy, how about your perspective?
Well, I think I share a lot of the similar perspectives. I was actually a late bloomer in becoming a nurse. I went through college pretty much the whole time my kids were in college. And so, but in previous roles, you know, I've done some teaching in different organizations and stuff like that, and always really enjoyed it. And then when I became a nurse, you know, like Rebecca and Anthony were saying, I loved having the students. You know, I know that there were some nurses that it was more of a bother than anything, but I would always seek them out because I loved the curiosity. I love being part of that learning and that growing, and kind of just guiding them, you know, giving them opportunities to fail and picking them back up. And, you know, so that was really something as a nurse that I loved. Honestly, I think that probably one of the biggest factors in becoming a nurse educator, because originally I was on track to become a nurse practitioner, was because of my experiences in the BSN and MSN program at Delhi. You know, I loved the way that the program was set up. I loved that you know, we take more of a constructivist approach, and that even in subjects that like health policy that I'm not a big fan of, there were opportunities to bring it down to things that mattered to me in my own personal life. You know, and just to be a part of an organization like that, it really, it inspired me to want to be more than just a bedside nurse, but to be able to be one who was a part of raising up a new generation of nurses, and even now, you know, in raising up a new generation of nursing educators.
Thank you. Karen?
Again, the same, everything that everyone is saying is what I am thinking in my head. I love to see students learn when it finally clicks and they understand what I'm hoping that they will eventually learn. Now, my experience is different because I teach online currently, so I haven't really taught nurses on the ground in person before. I have taught nursing assistant students, which was a long time ago, almost 20 years ago, I think. And that was my first taste of really teaching anyone before. And that was as a clinical instructor at a couple of university hospitals on the West Coast. And I had students that were mostly adults. And so I was young, and that was a new experience for me, teaching adult learners and coming with all of their own various life experiences and bringing that to the field of nursing. And the basics, I remember being with a student once who actually had been a refugee and a mother. And this was this new career for her, and she was going to become a nursing assistant. And I remember sitting with her and she was in a chair across from me and teaching her how to do a blood pressure and just having her listen. And when she finally got how to listen for that heartbeat and figure out how to find a blood pressure, and she just burst out into this huge smile and was so excited. And I just shared that same excitement with her. And that was the moment I decided that I have got to become a nurse educator. It took a very long time, but I'm finally here. And so that's what continues to drive me. Plus, I've had some amazing mentors and role models from when I was an LPN. I remember the nurse educators I worked under, and they boosted my confidence, and I want to do that for others and help them to grow as nurses or become nurses, grow as nurses, etc. So
Thank you. I think what is interesting is that I think we noticed that there is such a special bond between nursing faculty and their students. That is really, it's hard to put into words sometimes, but I think we all have had nursing educators that we still remember. We can still hear their voices. Don't do that, or do this. And you're going to be we're the ones now that you'll be those voices for your students. And I think it's really something very special and probably very special to nursing significantly. Yes.
And I think too, I was going to say along the lines of what Karen was just saying, some of my most favorite or the faculty instructors that I had in the past that taught me, it wasn't necessarily those that were the best teachers academically, but those that I thought, well, that's really what a nurse is, morally, ethically, that's how they treat me or how they treat students or how they treat patients. That's what I want to be. So those types of examples. So when I work with students, I try to be that person for them, the type of person that I would want taking care of my mom or my children or something along those lines. And that's really, that I take a lot of pride in that, in trying to be that person for them, to show them. Every job has bad examples. And so, I mean, I think that, and I'm sure most do, try to be that good nurse on all realms for their students.
I think we can share those sentiments. Exactly. Thank you. So now, according to the 2019-2020 AACN report on enrollment and graduations in nursing, United States nursing schools turned away over 80,000 qualified applications from baccalaureate and graduate nursing programs in 2019, as the need for qualified RNs in this country increases. In your opinion, what are some of the contributing factors to this crisis that we're facing? Tammy?
Well, I think like a lot of other organizations, sometimes it's all about the money, and having the budget that's needed in order to bring on new faculty, whether they be full-time or adjuncts, and being able to provide the numbers of faculty that we need for these extra nursing students to keep the faculty to student ratios at a level that's actually conducive for learning for both parties. And another factor, I think, is, we read different things about the age of a lot of the faculty, so a lot of nursing faculty members are like me, a little bit older, a little closer to retirement, and we're not getting the numbers of the younger faculty in, or once the younger faculty get in, they realize that maybe they could be making more money working in the clinical setting, which I think is also some part of the reason why sometimes we see kind of a foot in both areas, in education and, continuing in the clinical setting. And I wonder too, if at least in New York State, we've got the BSN in 10, and I believe that that's taken place in other states as well. So now, like when I went on for my bachelor's, it was because I wanted to learn, I wanted to grow. And now it's almost kind of, it's more kind of a mandate. Well, if you want to keep your job, you got to continue on. And so we've got, the students that are coming in because they want to, or they have a goal for becoming an educator or a nurse practitioner or one of the other advanced practice roles. But we also have the ones that are coming on board now, because of this BSN in 10. And I don't think that the nursing faculty staffing numbers have been able to keep up with the influx of all these extra students coming in. So I think that those are, some of the different reasons, for, having to unfortunately deny so many students. That's like a crazy number of students.
Karen, your take?
Yeah, you kind of hit the nail on the head there. I think even the AACN, didn't they put out a report? I think it was last year in July. Why they did a real evaluation of why is there a nursing faculty shortage, and there was the two main reasons were that faculty is aging out, they're retiring, they're older. I'm 45, so look how long it took me to get to the level where I am right now. And again, look at how much a nurse with a master's degree working as a nurse practitioner makes. It's around $110,000 a year, where average, you have to start as you're not a full professor when you begin as a nursing instructor. Full professors make a lot more money than a beginning instructor. And so that money difference, you might start at $59,000 a year after many years of graduate school as an instructor, and then you have to work your way up to a higher salary in academia. And so I know many people who started out in academia and worked towards that, but then ended up having to leave and go back to working full time and outside of academia because it was just, they couldn't really afford to do it. And then in my opinion, the third reason I think that we have a shortage is that many nursing programs, and not that I don't disagree, but they require a doctorate for you to be a faculty member. And then I think it's like 89%, 87% of open positions right now require a doctorate. Well, that's very expensive and time. It takes a lot of time to obtain your doctorate. And there isn't a lot of funding in my experience for nursing doctorate programs. Some programs do have funding, others do not. There's like the Jonas Scholarship for nurses, that sort of thing, but they're pretty few and far between. So in my opinion, that's one of the issues. So.
And so what are some ways do you think that the nursing profession should be tackling this issue? And maybe is there ways we could be doing it differently? I don't know, Anthony, would you be able to give some insight?
Yeah, well, I think about this constantly because I am very fortunate to now work in a setting where we just took on, I think, about 7 to 8 young faculty. And there's a lot of longevity in most of us who want to pursue this career. So I'm very hopeful in that aspect. I do think the issue is that, like, even when interacting with my students, they do think the next natural progression is to be a nurse practitioner. You become a nurse, you become a nurse practitioner at the end. And I've really nourished my floors that I work on, and I continuously reach out and I say, that's not the only option. I often remind people that they're great with students. If I know someone's very kind to them, they are very nurturing, just like a educator should be. And I really introduce them to the subject, and I'm like, this is a possibility. And I have noticed, like, and we all consider money as part of our career, but at the end of the day, I did go through that, like, do I become a nurse practitioner and make money, or to become an educator and love what I do? And I would never turn back. But you really, like, you make up that difference in money in creative ways anyway, because you have this thing when you become a teacher where all you want to do is sign up for more and more and more. So it kind of, in my opinion, it evens itself out just naturally. So I've never been super concerned about that. I really do think we need to shift how we engage our students at a younger age in their education, though. I really do think we need to start introducing them to things beyond their ADN program or things beyond their bachelor's program. Be very honest and say, a nurse practitioner is not the only route you can go. You can really go into academics and make a absolutely wonderful life for yourself and a wonderful life for the nurses who are coming up under you. So I think as the culture shifts a little bit, and hopefully this DSM-10 actually works out in our favor, I am employed in New York, so I'm really hoping it does, that they really truly see the need for better educators, and maybe the funding and everything will follow them.
Yeah, it's kind of, I remember, students coming out of nursing school and they always want to, what job do you want? They always want to be in the ER or ICU or, and it's like, wait a minute, there's other options. And I think you're right, Anthony, that we have to make sure that they don't have tunnel vision. And again, I think Rebecca said it, I did not aspire to become a nurse educator. It kind of just happened for me. And when it happened, it really clicked. But I just think that we need to teach them to have their eyes wide open all the time. And that's some good advice that somebody gave me once. So I always try to share that. Rebecca, do you have any thoughts on this?
I do. I think another important aspect to examine when you're talking about nursing faculty is retention, and keeping the faculty that you have happy and with you. And I think that there is a percentage of nurses that probably experience some sort of nursing faculty burnout. The demands go beyond what you just teach in the classroom. And that alone is a huge task, prepping for class, and then you have clinical, and then you have clinical paperwork, and then you have committees to be on. And as Tone said, committees that you want to be on and that you sign up for, even though you don't have the time to do it, you still sign up for them because they're very interesting. But I think there's a lot of workload that sometimes I think that may not equate to the salary that nurse educators make. And then when you add on to that, when you get those 7 or 8 new faculty, who's going to train those faculty? So I think a couple of things. So maybe addressing that nursing burnout and how to lighten that load or change the load with the addition, if you have adjunct faculty that can come in and teach sections of the lecture material, the subspecialties like the mental health, the maternal child, what have you, that can help lessen loads, perhaps on full-time faculty. Yes, that costs money for an institution to do so, but that might impact retention. And also, as many hospitals have, improving the mentorship programs you have for new faculty, just like hospitals have improved preceptorships or new nursing programs for new nurses coming in, to really kind of take the time to teach them the way or the lay of the land or how to do things. And so back to the example of the nurse practitioner, when you become a nurse practitioner and you start your job, you have a long preceptorship of learning before you're actually on the floor. And I know that's not always the case for educators, that you kind of sometimes you get educators, you get programs where they start as educators and it's really kind of like, here's your book, here you go, And so I think that investment in mentorship programs within institutions can help grow the staff and really kind of maybe help with retention as well, because I think that's a big issue as well, getting them in and then getting people to stay, and again, because that revolving door doesn't help the program, it doesn't help the institution, so I think that's something to focus on as well.
Great, thank you for all your ideas on that. The next question is, how did Delhi's MSN in Education program prepare you for the challenges of being a nurse educator? Karen, would you like to start, please?
Oh, I could say a lot about that because it's, that I always am like, I love Delhi, I tell everybody. Well, I teach online, as I've said numerous times, so that obviously learning online has taught me a lot of how to teach students online. Of course, all of you have precepted me very well in the back end of using the online, like Vanco Hall. I didn't really understand the back end of designing courses as well. And so that is something that I was given the opportunity to learn through working with the VLDD program or the VLDD course, which some of you, I know that you're not quite sure what that is, but that's just learning how to design courses online, more or less. I think also it's taught me time management skills, because when you're learning online and then teaching online, there's nobody to say you have to be here at 8 in the morning and then you have to leave at 5 or whatever, or 7 to 7. You have to find a way to manage the workload. and still have a life and not go crazy. So that's helped me. What I've learned through Delhi has helped me in that way. When I was thinking about this, when I had the questions beforehand, being that it was an online program, you don't necessarily have to have face-to-face contact with people, but I really sought that out because I felt that that was something I needed to learn when I needed to bring to the community, to become a better nurse. I needed that face-to-face interaction. And Delhi gave me those opportunities. It gave me the important opportunities of networking. There were like the Bassett event. I remember having a poster and going to the Bassett event and just being able to meet everybody and meet my professors or meet other nurses and nurse educators and practicing nurses in the community at a facility was an amazing opportunity, because now we're all there for the same reason. We're all there to take care of our patients, our communities, and improve patient outcomes in the very end and advocate for patients. So when we're all together, all these people with the same main goal, it's an opportunity that I would never have given up. You know, I'm very lucky that I had that chance. So
Thank you. Anthony?
I love this question because much like Karen, I am also very much a Delhi poster child. I got my BSN and my MSN there, and it was really, there's so many great things about Delhi, but one, it's the environment. I actually told Dr. Dean, I was like, I've never set foot on Delhi campus, but I've never felt more at home. And that's such a weird thing to have in an online program, because I've done other classes online in other institutions, and it felt so, I don't want to say cold, but it felt very hands-off. So it's just such a different environment to be at Delhi. And a lot of it came back to mentorship. And how they prepared us is like, I've always been a person who, I pull up the rubric, I follow the rubric, and I'm happy, I get the points usually, until I met some of my MSN teachers who were like, that's not enough. We need you to think, we need you to process, we need you to have a voice. And so they really started to challenge me to do that. And I was like, oh, what is this? Like, I've never done this before. And like, I really enjoy this. And so they really forced you to think about how you're going to adapt in healthcare and in education, because both are changing rapidly. So they explore just so many different technologies, and they kind of force you to really explore them yourselves. They give a lot of instruction in them, but it's up to you to really make the most of it and figure out how you're going to use that technology to your advantage. And I think the other really eye-opening thing is when I started my first couple of years of teaching here, I was completely taken aback about how the educators I'm working with, I was teaching them about exam question analysis. I was teaching them about curriculum connections, which we just revamped our entire curriculum and we had to rebuild those connections. Technologies of every sort, especially with the pandemic that went on, they really struggled because they're very much a face-to-face institution. So I was like, wait guys, I got this. Like, I know what to do. And then research methods, everything. And I was just completely taken aback by what an influence I can have. And I really facilitated my colleagues into these technologies and being almost like guiding them, being like, it's okay to introduce these into the classroom. Like, I've seen it done before. And actually some of the ways Delhi even models their classroom, I've really taken it back, and I'm like, you know, they did this really well. Like, here's some suggestions, like, just like with how things are formatted, just making it look pretty. And you wouldn't think that stuff matters, but it really does. And I just can't say enough about how they prepared me. I was just completely floored that the level of preparation. So.
Thank you. And yes, you are the poster child for our programs. Thank you, Anthony. Tammy, what's your take on this?
Well, I began as in the nursing education program about the same time I started working as a clinical instructor. And so I was a clinical instructor in the hospital that I worked at for like 5 years. And I was in the float pool, so I knew the doctors, I knew the nurses, I knew the floors. I thought, how hard can this be? And then I found out how hard this could be. And I loved my experience, but it was just, I kind of, towards the end of my first clinical group, I was like, guys, I'm so sorry. You're my firstborns. I'm learning along with you. And, one of the very first things that I learned was how important it is to be engaged with students, whether you're face-to-face or whether you're online. And I think Delhi, the education that we got there, it was very personal. And like Anthony, I felt very connected, to the faculty members. And then, having an opportunity to get involved with the honor society, that kind of shed a different realm of relationship and mentorship. But one of the books that we used in one of the courses was Clinical Teaching Strategies in Nursing. So that was kind of like my baptism into nursing education. It was kind of a baptism by fire because I really didn't know what I was doing, although I thought I did. And so I just felt that, there was just no stone unturned, whether you're going in as a clinical instructor, and then I taught lab, and then I taught third semester in an ADN program. And it's just like, no matter which area of nursing education, it was touched on in the program. And I felt that, like Karen said, the VLDD course that was a wonderful, wonderful addition to the program, and having the opportunity to be a part of that. And one of the things that I appreciated most about that was just the emphasis on being able to create a community and a relationship with students, even though you're not really face to face. And even now, I'm finding that more and more I'm meeting with my students. I'm just finding reasons to meet face to face with my students, because it just builds that trust, and it builds that connection, and that almost kind of like that family, that community of learners, that's so important. And I just feel that, the role models that I had as educators in both programs, the bachelor's and the master's, that, as I progressed through both programs, I was like, this is what I want to do. This is what I want to be, and just that camaraderie and the mentorship, and like, I forget who was talking about that. The mentorship is so important, not only as a student, but, then afterwards, having that mentorship to be able to know how to interact, how to ask questions, how to dig deep, how to look for answers for things that you don't know. And then there's accreditation, everybody's favorite topic, and I remember going through the master's program, and I think that there's been some changes now, but I'm like, really? I got to look at the essentials again? And now, having to do it as an educator, at the ADN level, and now at the bachelor's level, it was just such a good foundation. And I really didn't quite appreciate it at the time, but now, I just really appreciate even those types of things that we learned as nursing education, where, it's not that face-to-face, but it's all the stuff that goes into it, even behind the scenes, that is so important to have not only a successful course, be a successful educator, but also to have a successful program. So I guess those are some of my thoughts.
Thanks, Tammy. Rebecca?
Just to, I guess, kind of echo everyone's love for VLDD, which I feel as well, because I was a student in the class, and then I was an administrator for the class. And that happened just about when COVID hit. So myself and the two other students that managed the class with Dr. Digger, it worked, and we were learning a lot while trying to manage the rest of our chaotic lives, like everybody was. But then when I got to the fall, and now I was teaching students online, like freshman students who had never taken an online course before, I felt really confident and so thankful that I had that opportunity to practice on other students, but really to speak to what Tammy said about the connection, or learning how to connect with students in a virtual way that I wouldn't have known otherwise. And I think it really benefited me as an instructor to be cognizant of that disconnect, and try to engage these students and guide them through, and work with them, and the importance of face-to-face, and the importance of just that engagement, which I don't think I ever would have realized the importance had I not taken that class. And I think my experience as an online instructor, a forced online instructor, would have been much worse, would have been very, not as productive. And that sort of echoes all the technology that is introduced throughout the MSN program. And to speak as what Tone said, I mean, I feel really confident with online technology as it relates to nursing education. And I am not a technology person by trade. And I mean, I graduated nursing school I graduated with my BSN in 2005. I mean, so I know Epic and Storian and Sunrise before I started the program. But beyond that, I didn't really know anything. But all of the technology that's woven and then repeated all throughout the program really makes a huge difference. And I think as nursing education advances, I think one of the trends, or what will continue to trend up, is that technology, is the investment in technology, the use of technology in the classroom. And and Tone's mentioned that he has some colleagues that are hesitant or unsure or really don't gravitate towards it, but I feel good with whatever ATI, Kaplan, whatever you throw at me, I feel like I got it. I can get it. And then to introduce faculty, some people that I work with, into different types like VoiceThread or things that, that I feel that I know very well. And APA, I feel like I know APA so well, thanks to Dr. Q, Dr. Levitt. I mean, I feel like I got it. But yeah, the technology and that connection and introducing that to the students and elevating the level of education for the students, all because of Delhi, 100%.
And so I just want to kind of give our people, our attendees, everybody keeps mentioning the VLDD, and I just want to let them know that it stands for Virtual Learning Design and Delivery. So basically, you have the opportunity of kind of teaching and an online course in a very short period of time with your peers and designing things and getting the principles down. And so what I'm hearing is that was extremely helpful in your nursing education careers now. And I'm assuming that with COVID, it was even heightened. And could you maybe give us a few examples of how that kind of, I know a couple of you already mentioned a little bit, but Anthony, do you want to?
Yeah, so I did take that VLDD course as well, and it was wonderful because it showed us how to have an online or presence online that's similar to a classroom. And it really, when you are in a face-to-face organization, that is a huge struggle when all of a sudden someone just tells you, all right, we're changing everything you know. So it did help because I helped create a lot of the new assignments that we had to suddenly make out of nowhere, and make them engaging and make it so the teachers are actually giving them active feedback in real time, and that we're actually engaging and just not giving them busy work, because it really took place a huge chunk of their education. Usually they covered a lot of our clinical hours, these new assignments. So really it was a lot of hand-holding with the other faculty and really showing them like, no, this is possible. Like, we can do this. So I do think Delhi just prepared us so well, especially that VLDD course, to really think about your objectives, how you're going to create the course, how you're going to keep them engaged, and how you are going to have your presence and make sure your presence is known. So I just think Delhi did that really well.
Yeah, I think you all have said that it's about really engagement and with students. And it's interesting, Anthony, what you had said is about you never stepped foot on campus, but you really felt a strong connection to the school. So that's pretty cool. I think we're doing it well, and we hope to continue to do that well. So that's our commitment. So it's great to get this kind of feedback for sure. Hopefully we have some students attending this webinar today. And so what type of nurse might be interested in pursuing a career as a nurse educator? And what advice might you have for them as they consider pursuing such a degree in nursing education? Karen, you want to start us off?
What kind of nurse should pursue nursing education? Well, I think somebody who continually wants to learn. There is always something new to learn, right? In nursing. Me personally, I think visualizing yourself or seeing yourself as a leader and a change agent. We're not stagnant. The nursing profession is not stagnant. It's a rapidly evolving profession, as we all know. So if you're somebody that understands that that nurses can use their voices to, that nurses are healthcare experts, just that we know nursing in and out, we know healthcare, just as physicians know medicine, nurses know medicine. I mean, nurses know nursing. So those nurses that understand that they can use their voices, become change agents, change the way that the profession is practiced, and impart that onto future nurses, I think come to the nursing profession as an educator will do well.
Thank you. Tammy, your thoughts?
Well, when I was thinking about the questions that would be asked today, the first thing, like Karen, that came to my mind was a love of learning, you know, and I've told people on multiple occasions that one of the reasons that I went into nursing education, excuse me, is because I love to learn. And now I get paid to love to learn, you know, because like Karen said, you know, it's always learning, you know, whether it's learning about the, you know, continuing to learn about the clinical aspects of nursing, because I'm not doing bedside nursing anymore, you know, but, or whether it's learning new pedagogies, whether it's just learning, you know, things about the topics that we're writing in discussion boards, you know, we're always learning, we're always growing. And I love the opportunity to not only, you know, I think that it's important to love to learn because we need to, especially if you're in a program like this, you know, where every week, you know, you've got some kind of engagement with students, and because students have the ability to write about things that they, you know, we give them a lot of choices on what they want to write about and what they want to share, you know, so there's always the opportunity to learn along with the students. I also think that, you know, nurses that have good interpersonal skills, you know, that they like to mentor, they like to precept, they like to take the time and use their own time and energies to be able to invest in other people. I think that's a really big quality. You know, there's a lot of nurses out there that like to do that. I had a lot of really great experiences with nurses on the floor, you know, even when I was in the float pool of just kind of, you know, showing me the ropes, and, you know, and those are the types of nurses that, you know, you want to see get into education of some sort, whether it's in the clinical setting, whether it's in an ADN program, home care, you know, there's so many different roles of even as being a nurse educator. But definitely the love to learn. I think that that's, you know, that was my number one thought.
Rebecca?
I think that, yes, definitely a love to learn and the love to share your passion or what excites you, and to help others discover within themselves what incites them or what excites them as nurses. And it's different for every person. And I think, so before I went to nursing school, I was a theater major at NYU. And one of the things that really kind of I loved about theater was the sense of family or collaboration when you're all working together to put on this one production. And I feel it in a way, it's very similar in education. Like you all work together, you all sit and discuss and decide on curriculums and goal setting and what you want the students to get out of this. And then you all work together to put it forth to the students. So I really like the collaborative process. And I think that does definitely exist in bedside nursing. But sometimes not. Sometimes you're by yourself doing care for multiple patients, but there's those moments when you all work together on one task, and that I really am drawn to that. I really like the collaborative process, and I really like being a member of a team. And roles change within teams, and I like that too. I may not be great at something, but I like to work with somebody who is, and so I think that's really important to recognize in yourself. If you really like being part of that team mentality and working with others, it's a really great gig to have.
Thank you. And I do want to read one of the comments from Bridget Maguire. And she writes that a common denominator between these outstanding individuals is enthusiasm. This is one skill that allows faculty members to grow no matter what the challenge is that is thrown at them. I hope Delhi has helped to fuel that enthusiasm. I always look for that when interviewing for new faculty members. And thank you for today's discussion. We have just less than 10 minutes left. I do want to do a shout out to the attendees at this time, is to please, if you have any questions for the panelists, to please use the Q&A section, and I'll be happy to relay those questions. I have one last question, maybe two, but so what do we've gone through this pandemic, and obviously that's going to change things, but do you see current trends in nursing education now? And do you see things that may need to change? And what would you say that might be? Anthony?
Yeah, I think one of the biggest changes that a lot of people are still fighting for some odd reason is the shift to mobile and online technologies in nursing. Really, it's not a future thing, it's here. And a lot of our lecture-based styles and all that stuff has to kind of follow suit and really start to adapt, because I can't tell you like how many of my students, like, they don't read those 400 pages of reading before they come to class anymore. That's just not a thing anymore. And so truly we need to start exploring things like video lecture formats before class and flipping the classroom, at least in that setting. Luckily, a lot of online schools and programs have already bridged some of that gap, and we have really kept up with it. But I do think that's something that we really need to start considering and really start pushing, because it's something that's necessary. And I think the thing I hear most at work is, well, these aren't the students I taught so-and-so years ago. And I'm like, no, they're not. The students changed, and so does their learning. And even from when I was in school, which is starting to get longer and longer ago, but it's changed so much. It is nowhere near how we used to learn. And I don't learn like them, but I have to learn how to learn like they do. And I think that was the biggest bridge to gap. So I think educators really need to start being honest with themselves and saying, if online technologies and things like that are the way of the world, which they are with telehealth and everything, we really need to follow suit and prepare nurses that can fulfill all these roles. So I think that's one of the biggest things I've noticed trend-wise. We just really have to start using that as a catalyst and really start motivating even those who are afraid to use technology to start using it.
And I think you're right, Anthony. I think, no one's going to read 400 pages before they come to class. So I think we really do need to explore, our modes of delivery of content. How can we use it? Are there online things? Are there technology things? And I'm hoping that there will be new things that will kind of excite students in learning different ways and excite faculty as well. I think that's really, really important. Karen?
Other than the technology, I think when I think of when I was in nursing school, the first couple of times, it was very hard, and there was little room for failure. COVID has changed the way I think that nursing programs are, at least Delhi, are treating students. We've always treated students well at Delhi, and I'm not going to say that we haven't done that, but the flexibility, allowing people to have flexibility in their lives and understanding that they're human beings who have lives outside of school, and that we need to treat students as whole people. We can't expect perfection. They need to do the best that they can for themselves. They need to, as I remember Dr. Digger always said, and this always stuck in my head, that they just need to meet the outcomes. They can meet them however they want to, as long as they meet those outcomes and they learn what they need to learn, then that's good. It doesn't have to be perfection. So I think COVID has given us all an opportunity to make our nursing programs a little more gentle and understanding of who the students are that are coming into our programs now today and in the future.
Thank you. Yes, I think that's something that all programs will need to kind of take a step back and see what is it that, we need to change. We're living in a very different world now, and we need to adapt. I think, again, looking at those, what Karen used about outcomes, it's that you met them. It's not necessarily sometimes how you met them. Maybe there's multiple paths to that. So I think that's a good point. Thank you. And Rebecca?
Sorry. I think it's also important to recognize the changing of healthcare delivery as a whole, and that sort of plays into promoting technology or using technological resources to help students learn, besides just the traditional classroom. You have virtual health, you have different forms of care delivery that nurses will be called upon to be a part of. Triaging somebody online is a lot different than triaging someone over Zoom is a lot different and has a different skill set than triaging someone in the bay of an ER. So I think that that's important to recognize. And I think that's where things are going. Personalized health, all of those trends in healthcare will, I think, ultimately change or should change how we teach the students or what we emphasize as modes of educational delivery for the students as well. And I do, as Tones mentioned, about taking it out of the traditional 400 pages before the classroom and changing it to a virtual lecture presentation, PowerPoint, VoiceThread, what have you, before the students come into class, or flipped classroom. All of those things, I think, will help the students become better educators, or better educators online or virtual educators, because I think that's where healthcare will go more and more as technology advances.
Agreed, and thank you for those comments. I have one last question, and actually it's from Michael. He recently saw a piece, and he believes it was in Forbes, and I've seen this rather of late as well, that nurses still are the most trusted profession in the United States. And so what role do you feel nurses have in using this trust to benefit the health of our nation? Anybody want to jump in here?
Well, I don't want to monopolize, but I can say that I think that, I mean, this is obviously the year of the nurse, or was the year of the nurse, and it's Nurses Week. But I had found that it's interesting, when I did the COVID vaccine clinics, that I had a number of people come through that were not 100% sure and were full of misinformation. And so, in discussing with them how super important it is to be able to maintain that trust by presenting the data, the science facts, and being up on our game in terms of current trends in nursing and current trends in science, so that we can remain those trusted, not only to our students but also to the community as well. And that, I think it's important to instill in students that there is, even though the rigor of a program may seem tough and it may be really challenging to you, there's a point to that, because you should be able to work with your patients, and they should be able to rely on you and for the information. So it's really important that you know what that medication does to that person, and that you're able to articulate, because that, if you lose that trust, I think then it's a downfall for nursing.
Definitely agree, and something that we need to make sure that our students are aware of as well. It is 1 o'clock, and so that concludes our program. I want to thank the panelists, Anthony, Tammy, Karen, Rebecca. Thank you so much for your time, your insights, your sharing of your stories with us, and I hope you all stay well. And it is Nurses Day, and so happy Nurses Day to everybody. So thank you, and please stay well.